Okay, this is going to be Nutrition and Health Nobel Prizes. So our current situation is that most of the American institutions have been corrupted by evil scumbags, by corporate atheism, and they destroy everything they touch. The public schools have become worthless. The public universities have become worthless. I mean, just for example, if you want advice about dating, you go to YouTube, you look at the internet dating coaches. They will tell you the truth about men and women. If you go to university, the university professor will say, well, there really isn't any difference between a man and a woman. It's like, shut up. They're worthless, okay? If you go to a lecture on art, you go watch one of my lectures on art. I'll show you all the beautiful paintings. You go to a college art professor, and he's going to say, well, modern art is just as good as regular art. It's like, shut up, you worthless, lying piece of shit. So anyways, what I'm trying to show you is that there really are lots of great scientists and physicians who've done wonderful things to help us learn and be healthier about nutrition and about health. And none of them ever gets into the textbooks because corporate medicine doesn't make money off them. So I'm going to start my own Nobel Prize here, and I'm going to award these Nobel Prizes. So the first one is to Walter Kempner. He figured out that a low-fat, low-protein, low-sodium vegan diet, the rice diet as he called it, with white rice, cured obesity, hypertension, diabetes, coronary artery disease, CHF, some autoimmune diseases, and some other things too, the complications of these diseases. And he is the grandfather of nutritional therapy. There's a great biography of him by Barbara Newborg. The doc will work with him, and his own book is really good. You can get it for free at drmcdougall.com website. Dennis Burkitt figured out abdominal pressure syndrome. He was a Christian missionary surgeon to Africa, and he noticed that the high-fiber, plant-eating Africans never got the typical Western abdominal diseases because of the dietary fiber. Okay, a great discovery. Nathan Pritikin came up with the lipotoxemia theory after reviewing all the literature on dietary fat, and he came to the conclusion that fat is bad. No matter what fat you eat, it ends up causing disease. And he also said it's impossible to be too low in protein unless you are starving. And he reviewed all the studies that showed that, and Dr. McDougall agreed. Rice Swank, MD, PhD. He's the guy who figured out that leaky gut seemed to be caused by high-fat diets especially, and this led to the production of blood sludge. He didn't phrase it as zeta potential overcome by, chylomicrons specifically, but he knew it caused blood sludge, and he made videos of it, and by removing the animal foods from the diets of these patients, minimizing their fat, he dramatically improved the outcomes in multiple sclerosis. John McDougall, so I would call Kempner the grandfather of nutritional therapy. I'd call John McDougall the father of nutritional therapy. He basically figured out the most important thing you can know, a starch-based vegan diet, which is what all large healthy populations eat, it prevents or reverses the common Western diseases. Obesity, hypertension, diabetes, coronary artery disease, autoimmune disease. And it even helped a lot of cancer patients like Ruth Heidrich, the famous cancer patient who's still alive 40 years after metastatic breast cancer diagnosis. So he's the father of nutritional therapy. Okay, he says when a person starts out, like a middle-aged and older person, they're sick, he says go 90% starch, 5% fruits, 5% veggies, okay? But a lot of people would say, if you're healthy and you exercise a lot and you're more like trying to prevent disease rather than reverse disease, you don't know what to do, and you know what to do, you can eat more fruit than that. I'm a big believer in that. I've been seeing how a lot of these fruit-eating people are pretty healthy. It gets complicated to talk about the fruit. We're not going to get into that now, but there is room under some circumstances to eat significantly more fruit than just 5% of your diet from fruit. Caldwell Esselstyn, low-fat vegan diet, reverse coronary artery disease. He's got the best results to prove that of anyone. Gregory Sloop, MD, pathologist, looked under a microscope and said it's a blood clot, atherothrombosis theory. And he showed that that's been known that atherosclerosis is a blood clot going back to the mid-1800s. Rokitansky knew that back in the mid-1800s. It just got covered up because all this efforts to sell statins for cholesterol drugs. But atherothrombosis theory is a summary theory, and the relevance is that once you know that, you know anything that causes blood to clot is going to increase atherosclerosis risk. William C. Roberts, the greatest cardiac pathologist, he also looked under a microscope and he said atherosclerosis is a blood clot. The main risk factor is high blood cholesterol, and that's because high blood cholesterol, LDL cholesterol, sticks red blood cells together. It overcomes the zeta potential. Okay, and a high-fat meal with chylomicrons sticks red blood cells together, and triglycerides also stick red blood cells together. Also, my favorite thing from him was he showed on his autopsy, he did over 2,000 autopsies of patients who died from heart attacks. He said, look, the coronary artery disease was always diffuse. This thing that people would talk about from cardiac cath of single vessel disease, he said that is a myth. There's no such thing as single vessel disease. It's always diffuse of similar severity throughout all three coronaries. So what that means is you're kidding yourself. You can never treat that with a stent or surgery. There's no focal therapy that can treat all the coronaries diffusely. So what that means is it's going to have to be drugs or diet long term. And we know diet works. Why not do that? Why not go low-fat vegan? It just makes sense. And the same diet treats hypertension and it prevents diabetes. Why wouldn't you want to do that? It makes you skinny. Skinny with no diabetes, no hypertension, no coronary artery disease. Isn't that what you want? And that's what we know works. So why not do it? Okay, a lot of people say to me, well, do I really have to do this? And here's my attitude. Look, all the people who eat this way, all the Westerners, almost every single one of them is screwed. They're fat, sick, and stupid by 60 years of age. Do you really want to be in that group? Why not be in the group where you've got a chance, to be skinny, smart, and healthy up to 90? I mean, there's no guarantees, but you got much better odds. Believe me, I can do whatever I want. And I go low-fat vegan because it's the best I can figure out from studying this stuff all the time for decades. Okay, who's next? T. Colin Campbell, he figured out animal protein, especially from milk, was the #1 cancer promoter out of anything, and he could turn cancer on and off in rodents by minimizing animal protein. Douglas Kell from England, Etheresia praetorius from South Africa, PhDs, they figured out that leaky gut allowing bacterial endotoxins, LPS and LTA, into the blood, or being iron overloaded from high meat diets and processed food fortified with iron, or having a viral infection, they all can cause amyloid clotting in the blood. Those are the dense matted deposits, refractory to lysis, means refractory to being dissolved, and they are bad. They plug up arteries in the heart and the brain. Not good. They're typically 2 to 200 microns in size. You don't want those things plugging up your arteries. So avoid the things that cause leaky gut. Okay, and don't be iron overloaded. Weston Price, yeah, I know there's a Weston Price Society which corrupts his name, but the couple big things he figured out. He figured out that root canals are really toxic. People can get very, very sick from infections related to root canals. And he also figured out the modern diet destroys teeth. He traveled all over the world and said all the old-fashioned diets protected teeth. Modern diets screwed up because people didn't even brush their teeth with all the old diets, and they were fine. That was more important, the diet, than whether they brushed their teeth or not. Dean Ornish, he figured out the vegetarian diet was able to stabilize low-grade prostate cancer. Vegetarian diet was helpful for treatment of coronary artery disease and for maintaining telomere length. Okay, Alan Goldhamer, he figured out the pleasure trap mechanism of food addiction along with Douglas Lyle. And Alan Goldhamer also found that by fasting patients, he has some case reports of curing lymphoma and case reports of lowering LPA. No one else would have predicted that was possible, but he's proven that it is in some cases. Okay, next we have Martin Moore-Eade. He is a sleep doctor who he's an MD PhD, did his research in sleep. And when he figured out all kinds of things about circadian rhythms, the most important message from him is avoid blue light so you could sleep. Okay, but he figured out a bunch more than that. He figured out the pituitary, how it's a clock, and the hypothalamus. Robert Seahold, he's got great lectures on the benefits of sunlight, red light, and how to sleep better. He's a specialist in sleep medicine, real smart guy. His YouTube channel is MedCram. Richard Moore, MD, PhD, he wrote the book High Blood Pressure Solution. It's a masterpiece, and he explains the K factor, how you need to eat at least 5 times, preferably 10 times more potassium than sodium. Otherwise, you're screwing up the plasma membrane ion pumps in every single one of your cells. So there's no way around that. No medical, surgical bullshitology or pill could fix that. There's no way around that. So you either eat the plant foods or you're screwed long term. And he said, look, you just got to look at the epidemiology around the world. Populations who eat that way, they don't have hypertension. And the ones who don't eat that way, they all are sick. And he also said you can treat hypertension with meds, but you don't decrease the stroke risk that much. When you fix the diet, you dramatically lower the stroke risk, in part because all the cells are functioning a lot better. Okay, we got a bunch of people who did magnificent work on diabetes. That would include J. Shirley Sweeney, Michael Brownlee. I don't know why my thing is wrapping around to the other side. J. Shirley Sweeney, Gerald Shellman, Roy Taylor. They all did magnificent research on fat causes diabetes. And the most magnificent paper of all was the Michael Brownlee paper, Unifying Theory of Diabetes Complications. Okay, fat causes diabetes. You need to know that. Okay, Christopher Exley, his name is Mr. Aluminum. He figured out the toxicity of aluminum, which is in your drinking water. Jim Moon, Randall Lawfer, Eugene Weinberg, these guys figured out the toxicity of iron overload. I would add that Douglas Kell and Etheresia praetoria also figured out some of the toxicity of iron overload, perhaps the main mechanism. Jane Hightower, Hal Huggins, Murray Vimy, and Boyd Haley, they figured out mercury toxicity in all its different manifestations. Bug Haley made a successful treatment to it, and it got blocked. They orphaned his drug, so it's not available to people. The only chelator that actually works. Stephanie Seneff, she figured out GP toxicity. She wrote an entire book about it called Toxic Legacy. Anthea Hayes is a lady who just recently wrote the book about the enigma of vitamin B12. It's a magnificent book. Man, is it a smart book? And she came to the conclusion that vitamin B12 is a fake. It's a scam. It contains cyanide. The worst is cyanocobalamin, is the highest amount of cyanide. But she says even methylcobalamin contains cyanide, and hydroxycobalamin contains cyanide. So I decided not to take it anymore. I'll recheck my levels in a while, see how I feel. But I decided not to take it anymore after I read her book because her logic was good. It was impressive. She also said vitamin D pills don't work. Dr. McDougall said the same thing, and she said they're made such that they contain cyanide. She said creatine contains cyanide. So she recommends not taking any of those things. I wouldn't take any of those things. Dr. McDougall says he would never prescribe vitamin D to anybody. The only exception might be if somebody was institutionalized and couldn't go outside and get some sunshine. Food fortification was, her conclusion was basically a scam. Like they say, oh, everybody's iron deficient, so you got to put iron in the food, and then they make tons of money putting iron in all these processed foods. It's for chumps. Tyrone Hayes is the guy who figured out atrazine toxicity, turning the male rats into female rats. Okay, and what was his reward for that? Okay, he's a black guy, so black guy makes a genius achievement. They should give him the Nobel Prize, make him famous. No, because he goes against corporations, and he's not, an affirmative action kiss ass, easy to control. The guy's a brilliant scientist. So what do? They screw him over. They take away his funding, try to ruin his name, ruin his career. Okay, that's what happens when you do something useful, not this BS. Okay, Dean Murphy, DDS, and John Yomiyamis, PhD, they wrote the best books on fluoride toxicity. Jeff Nelson over at VegSource has the best YouTube channel for health topics, okay? And many of them, the videos by Nelson himself, and he doesn't sell out to corporations, and he just shows good videos on his channel, okay? Thomas Seyfried, PhD for research on metabolic theory of cancer. Okay, Lorraine Day, she figured out a comprehensive theory of cancer treatment, including low-fat vegan diet, smoothies, hydration, sunshine, walking, religion, and stress management. That lady is a genius. Several doctors figured out excitotoxicity theory of brain damage. John Olney, Russell Blaylock, Dennis Choi. Okay, Jack Delatorre figured out the vascular hypothesis of dementia. And there's several other theories. I should have put Tetsumori Yamashima on here. I know I forgot him. If I forget anybody else who you think belongs on here, please let me know, and I will add them to this and for next time. So I should have included Tetsumori Yamashima. He's the one who figured out the reason for the big increase in dementia amongst Japanese people is they're eating all this fried food nowadays. So that's the Tetsumori Yamashima theory of lipid peroxidation and the Calpain-Cathepsin theory, it's called. Okay, and then there's myself, of course. I figured out the supply and demand theory of dementia, which is really the all-encompassing theory of dementia. It includes all the issues, including stimulants, mitochondrial inhibitors, SERCA inhibitors. So it takes in excitotoxicity, it takes in hypoperfusion, and it adds that to all the other stuff to explain it. Okay, I have the best theory in the world. So not only of a brain degeneration, but also a spine degeneration, the ischemic and biochemical theory of spinal degeneration. I give multiple lectures on that. I have the best lectures in the world on the role of mitochondria inhibitors in disease, figuring out 120 of them, and I basically rewrote all the textbooks in internal medicine and neurology and correcting the ubiquitous errors. The books are a disgrace, they're a joke. And the reason why doctors don't know that is because they don't read anything else. So it seems to them like, well, the book's already been written. This is all there is to know. But once you've read the scientific literature, the epidemiology, the nutritional literature, and all this other related literature, then you're like, the medical books are a comic book. They're just good for selling drugs. Well, anyways, I hope you found that helpful. And if you know of anybody else who should have been included that I forgot, please let me know, and I'll try to, see if they deserve to be included for next time. I hope you found this interesting and helpful.